Welcome to the only patient advocate podcast you'll ever need. In this podcast, you'll learn how to advocate for yourself and your family, and where to turn when if that becomes overwhelming. Now, here's your host, Joyce Schulz-Killian, registered nurse and owner of At Your Request Patient Advocate, LLC. She is your private patient advocate. Here at your request to communicate, educate, and advocate with and for you.
Hi, I'm Joyce Schulz-Killian, a registered nurse for 27 years and in healthcare since I was 18 years old. I'm the owner of At Your Request Patient Advocate, LLC. I'm here at your request because I am your private patient advocate, helping you navigate healthcare one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm hoping to give you the tools you need to be your own best private advocate. Find me on Facebook at Your Request Patient Advocate and on Instagram at JSKICURN, and on Twitter at RN Advocate for you, the number 4 and the letter U. Hit like and subscribe if you like what you hear, and tell a friend. Today we are discussing palliative care and hospice care. And what makes them different. Some people have preconceived notions about both of these subjects, and I hope today to provide some information you have never had before and some knowledge that is new to you. We have no facts right now to start with. I have no demoralizing facts or scary events that happen. Hospice and palliative care are great benefits, and I have nothing but good things to say about both of them. So first, we'll start with palliative care. Palliative care is an amazing benefit through your Medicare Part B. It's the medical insurance. Even private insurance has medical Part B. It can pay for services that fall under standard Part B fee-for-service benefits, such as doctor visits associated with palliative care, whether they're hospice-related or not, and that's important. So it is paid like a doctor's appointment, so ask about copays if and how much they are. That should be your only out-of-pocket is your copay. Palliative care is paid for in full by Medicare Part A when it is considered hospice care. Remember that for later. So when palliative care is really hospice care, it's paid under a different benefit and it's named differently. So how do we get on palliative care, and what is palliative care? Palliative care is based on need, not prognosis. It can be appropriate at any age and during any stage of a serious illness, whether the condition is curable, life-threatening, or chronic. Palliative care can be provided alongside curative treatments like chemotherapy, radiation, or surgery. It would require a referral or a phone call to inquire regarding palliative care services where they are offered. Palliative services are offered in hospitals. A lot of them have their own palliative programs from private agencies that also sometimes have a hospice attached to them, and through medical specialty offices that deal with symptom management, so palliative care. People with heart disease, cancer, stroke, diabetes, kidney disease, Parkinson's, and Alzheimer's disease are the ones utilizing palliative care the most. Palliative care is symptom management. Palliative care treats the whole patient and is like a wellness monitor. It not only treats pain and symptoms, but covers the emotional, psychological, and spiritual well-being of a person. Research shows that people who utilize palliative care are more satisfied with their care overall. They have their symptoms managed the best and have overall better family satisfaction during their disease management. Palliative care can be provided anywhere the patient is. It can be provided while a person is in the hospital, at home, in a clinic, or in a nursing home, wherever you reside. Palliative care. There's a website, palliativecare.org, so GETPALLIATIVECARE.org. It's a site where recommendations of places and organizations registered as palliative care providers can be found based on the demographics. So you put in your zip code and it tells you what palliative care services are available for you. Palliative care is made up of a team of providers. Hopefully, as it appears, they would need a social worker on board, a chaplain to be able to offset the burden of the nurse practitioner that is actually seeing the patient, or the doctor. There's a medical doctor that either oversees the care or sees the patient themselves. The palliative care doctor or nurse practitioner you would normally see about once every 2 to 3 weeks. Unless you're very symptomatic, then it could be more frequently. But remember, each visit is billed separately and requires a copay if you have just one, like in the doctor or office. So if you see a palliative care person 3 times in a week, you're going to have 3 copays. Palliative care adds that extra cushion of protection and support patients need. Palliative care not only treats the patient, but they look out for the care providers that they are taking care of. They can recommend respite programs for relief and support groups for the caregivers. They can also assess the need for social support, like appointment assistance and transportation recommendations, maybe Meals on Wheels. This probably is left in the hands of a social worker. They can find resources for housing and food programs too, like Meals on Wheels. They provide social support for the patient and their caregivers. Palliative care specialists will talk about specific goals of the treatment throughout the treatment, because goals can change. It's a holistic approach to care for not only the patient experiencing this, but for the family, all of the family. Patients and family can call 24/7 and get answers to questions they have or the symptoms they are experiencing. The palliative team will meet with your providers and you together to manage the disease process. If there comes a time when the goals have changed and maybe the burden of the treatment outweighs the benefit of the treatment, then that's when hospice might be the next choice for care. So let's talk about hospice. 8 minutes in and we're already talking about hospice. This is crazy. Hospice, that H word, it has a huge stigma attached to it, and hopefully I'm going to demyth that for you today. Hospice is actually an amazing benefit that I believe has gotten a horrible rap. It is not the 1 foot in the grave, take away all of your medications, wait for you to die benefit. That's not what hospice is. It really isn't, unless that's what you want it to be. Trust me, and if you ever feel that way, all you have to do is say, I don't want this benefit anymore, and the benefit goes away. The integrity of palliative care as well as hospice lies with the company. Lies with the company? Lies with the company. And that's the truth. Oh, I didn't bring anything down to drink today. Now let's discuss the H word. Hospice is approved for a person who has a life-limiting condition that is determined to cause them to have about 6 months to live, and they are choosing not to have an aggressive treatment approach. Now, the thing about the 6 months to live is this. Who knows that? Me? Nope. The doctor? Well, he can take a guess, but there is only one entity that knows when our time is up, and it's not me or the doctor or the nurse certifying you for hospice care. She can take a good guess. Everybody can take a good guess, but that's all we can do. Certification for periods for hospice are 90 days, so 3 months, 90 days again, and then unlimited 60-day periods of time. So 90 days and 90 days puts you 6 months out, and then there's 60-day periods of time after that. So you're evaluated again at those times, and I've seen people on hospice for years. I've seen people on hospice that graduate from hospice, so I've seen both aspects. As long as there is a slow decline, the benefit can continue. The sad ones are the ones that only get the benefit for a short period of time, like a week, a few days, or even just a few hours. Those are the ones that I feel my heart goes out to, because they don't get to experience that extra attention that comes with hospice. So here is some research out there. There is research that shows that people who start hospice earlier tend to live longer than their life expectancy of their limiting disease. Truth. Hospice is paid under the Medicare A benefit. So this is the hospital benefit, because essentially you're giving up your choice to go to the hospital for active treatment for the hospice benefit. So you're saying that the burden of that treatment outweighs the benefit that you would get. So going for your chemotherapy or your radiation, those symptoms, the burden of that treatment just outweighs the benefit. So now you're choosing to have comfort care. So let me tell you about the benefit, because it encompasses a lot. There's a team, just like with palliative care, but this one is much more distinguished because I'm sure because Medicare tells them what they have to provide and by whom, it is much more distinguished. Medicare definitely drives the hospice benefit. So there is a registered nurse who oversees the team. She is the case manager. There's a social worker assigned to you. There's a CNA, a certified nursing assistant. There's a non-denominational chaplain if wanted for spiritual support. And there's also a medical doctor on your team. It is as good as that palliative care, providing that holistic comfort care, but in a meaningful way. The roles of those people are also regulated by Medicare. The nurse has to visit once per week at least. There are agencies that send the nurse twice a week or more if the condition warrants. See, that's the thing. Medicare has told them what's expected, but the companies all get the same amount of money to do with what they want. And the difference in some companies is really apparent. The amount of money is exorbitant, to say the least. The registered nurse is monitoring your symptoms and checking for progression of the disease by her assessment skills. So she's coming maybe once, twice a week, sometimes 3 times a week, depending on how you are. And her assessment dictates and drives the care. She is then doing what she feels needs to be done based on the assessment, which could just be education to the family. I don't want to say just education, because education is truly important, especially where hospice is concerned, because we're educating them on the disease process, what to expect next, and how this disease is going to show up. So, or it could be reaching out to the doctor or the pharmacy to get different medications or a new medication on board, depending on what's happening with the patient. She could also be following up on something the CNA was concerned about. The CNA usually comes out 2 times a week to provide basic care like a bed, bath, or shower, whatever the person can tolerate. They can also be there to do light housekeeping and just relieve the caregiver. But there's a company that sends them out 5 days a week. There's only one company that I know of that does that, and that company is Suncrest in Northbrook, Illinois. This is a shameless plug for them. I'm not getting paid. I don't sponsor them. I just support what I know is right. Their phone number is 888-308-8206. That's their toll-free number. I know Suncrest does have companies scattered all across the United States, so I gave the toll-free number for anybody that's listening. So that CNA is the eyes and ears for the nurse. They not only provide comfort and care, but they really are the one reporting the little changes to the nurse. And what better way to see those changes but as they happen. Why it is important that they come out so much and give that extra care. Plus, your family member deserves it. This is a highly stressful time in their life. Even if they don't give a bath every day, they could come do hair and do nails, do hand massages, things like that. Just spend time with the person, read to them, sing with them, do all kinds of things. Because the nursing assistant sees things the nurse may not, the nursing assistant could notice concentrated urine and report it to the nurse. The nurse can then call the doctor, and maybe the person needs an antibiotic. Such an amazing benefit that CNA provides coming out there, especially when they come out there so often. Then there is a social worker who has a magic hat of tricks and all the benefits and and all these benefits and community resources I, as a nurse, have never even heard of. I've always respected social workers. They do. They have like this magic hat. I think of it like the Frosty series where the magician pulls the hat out. That's what I think of when I think of the social worker. They find people who cut hair at home and specialize in this demographic of homebound I never knew existed. So they found things for me that I didn't even know were out there. They're an intricate part of the team and can meet with the family as much as needed. There's also a chaplain or a non-denominational clergy available for those not having community congregational support. They do offer that. I've been part of some of those, some of these non-denominational celebrations of life, and they can be quite amazing. These people can be available as much or as little as you want also. Sometimes therapy services are provided, like physical, occupational, and speech therapy if they assist in relieving pain or symptoms. Some agencies have volunteer services for music, massage, and pet therapy, but these are generally not offered as much due to the lack of availability of these services. So sometimes they'll tell you about the volunteer services, but then they do give a disclaimer saying that, there's a lot of people here, and for everybody to get those services is a little difficult. The medical doctor is also a benefit of hospice. That doctor is available with your medical doctor to provide recommendations and orders, so they work directly with your medical provider. Most of the medical providers, though, the physicians that are outside of hospice, relinquish care to the hospice doctor, as they don't feel as comfortable prescribing medications during this very delicate time of your life. But the medical doctor at hospice collaborates if needed, and your doctor is kept informed if you want. That is only the beginning of the hospice benefit. So let's talk about the other benefits of hospice. Any and all equipment you need is covered. Oxygen, period. Hospital bed, period. Wheelchair, suction machine, CPAP, BiPAP. Even ventilators have been approved through hospice. Crutches, bedside commode, just ask. The thing is, they can approve or deny anything, so it doesn't hurt to ask. These people I've seen people approved for dialysis for a short period of time if it helps relieve their symptoms causing them pain or grief. The thing is, with hospice, they meet every 2 weeks or so. I think they are meant to meet every 2 weeks. They have these meetings where they all come together and they talk about each person, and they can approve medications, they can approve treatments during this meeting when they decide, again, what they're doing with all this money that Medicare gives them. So they also cover diapers, wipes, and care supplies like mouthwash and mouth moisturizer, and even urinals. Medications are also covered for the disease that brings the person on hospice care. So say it's congestive heart failure that is the deciding diagnosis that is limiting the lifespan of this person, and they have chosen a non-aggressive approach to care. All of the medications for congestive heart failure are covered, plus any comfort medications like morphine that relaxes the smooth muscles and allow breathing to be unlabored, Ativan that causes a decrease in anxiety, which can be caused by the inability to breathe. So say if the person develops an infection, those meds are covered too. Antibiotics are covered under the hospice benefit. So they are treating those things where people think that they don't continue to treat, they do. Anything that causes you discomfort, they don't want you to experience. That is the whole basis of hospice, is comfort care. The medications are ordered and delivered through the hospice pharmacy, so you don't have to worry about that. If other medications are needed, say insulin, because the person is also a diabetic, those would be purchased separately by the family under the Medicare benefit for prescription drugs. What else? So much is given with this benefit, and fitting too, seeing it's the last of the benefits Medicare may give you. Medicare defines 4 distinct levels of hospice care. The 4 levels of hospice care defined by Medicare are routine home care, which we have discussed, continuous home care, general inpatient care, and respite care. Continuous care is given when and if things become overwhelming or the symptoms become unmanageable and at times at end of life. A nurse is sent to the home to care for the person 1-to-1. This is evaluated every 12 hours to see if it is still necessary per Medicare guidelines. This is paid to the hospice at a different rate than the regular hospice services in your home, wherever home may be for you. So again, they can come wherever you are, nursing home, community, your condo, your home, your neighbor's home. If that's where you're staying, they'll come to you, or in the hospital. General inpatient care is provided also at end of life or if symptoms have become unmanageable at home. This is if the hospice has an inpatient facility. Hospices, and there are only a few that have inpatient facilities. A lot of these services for the continuous care can be provided in a hospital setting. Hospitals that have hospice will admit them and put them in a special area, and then they will manage their symptoms that way if they don't have if it is not a self-standing entity that has an inpatient unit. Hospice can also provide a respite stay if things become overwhelming to the family or the caregiver. This is provided inpatient if one is available, or the hospice generally has contracts with the communities nearby to facilitate a stay to relieve the family. Hospice also offers grief counseling for 12 to 14 months after the family member passes. And some have offered it longer than that. Some have offered it. I know hospice agencies that offer grief counseling to patients that weren't even in their hospice. So again, it's about the integrity of the company. And if you need to know which companies have the better benefits, I can tell you Suncrest is one of the best. I won't say that enough. I can't say that enough. So as you can see, the hospice benefit is really a great benefit when the time is right. Until then, everyone at any age can have those extra set of eyes watching over them with palliative care. So whether it is palliative or hospice, it's a wonderful benefit that really outweighs the stigma either of those words hold, especially the H one. So I hope today I've answered some of your questions. My dog barking, I'm sure that it was entertaining. I hope that I've answered your questions. I hope that I've made hospice a more real choice for you, because again, it always disheartens me to see a patient on hospice for just hours or days or a week. Because I know how wonderful the benefit of all that extra care is. So you're not going to get approved for hospice if you're not ready for hospice. There's a lot of things that go in to the benefit, the approval process of the benefit, your treatment goals. If your treatment goals don't align with comfort care, then hospice isn't the right benefit for you. Then maybe palliative care is the right benefit for you. And they'll tell you that. And if during palliative care your treatment goals change and the burden outweighs the benefit of the treatment, you can always go to hospice after that. And again, I have seen people on hospice for months and months, even years. I've seen people graduate from hospice. Once again, Thank you. I'd like to thank you all for listening. And if you like what you hear, please hit like and subscribe and tell your friends. I'd like to thank everyone who has helped me take the plunge into this podcast and with all of my dreams I've had in the past 8 years. Remember, I am your private patient advocate, and I'm here at your request to help you navigate the healthcare system one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm here at your request because I am your private patient advocate. Find me on Facebook at Your Request Patient Advocate, on Instagram at JSKICURN, and Twitter at RN Advocate, the number 4 and the letter U. Find me on YouTube, where you can also find this podcast. Find me where you find all of your podcasts, wherever that may be. Hit like and subscribe, and tell a friend.